Hi, it's the nursing professor here. I want to talk to you today about cranial nerves. I've gotten a lot of requests about how to do a head-to-toe assessment, and so let's start at the head, where all 12 cranial nerves exist. All right, so number one is smell. So I can remember cranial nerves by just washing my face. So one is smell. Two is vision. So it's actually looking at the acuity of your vision. Then we go to 3, 4, and 6. That is all about eye movement, ocular movement. And so you would do things to test your patient by having them keep their head still, look up, look down, look towards their nose, look to their right, look to their left. And so you're just watching the movement of the eyeball. So we just did 1, 2, 3, 4, and 6. So then we have 5. 5 was missing, and that's trigeminal. And the trigeminal nerve is quite important. It works with facial sensation. And so one of the tricks to testing trigeminal nerve is to have the person close their eyes and prick them with something sharp or something dull or something soft like a feather. All right, so that was 1 through 6. Now we get to 7. 7 is known as the facial nerve, and 7 is where we're actually going to assess facial movement. So we want to know strength. Like you can have someone close their eyes, don't open it, or to smile real hard, or just to turn their face, give them some resistance, those kind of things, because it's all about the facial nerve that innervates the face, and so you're assessing that. Now, cranial nerve 8 is about the ears, hearing. 9 and 10 go together. 9 and 10 is what we typically remember as when you go to a provider and they say, open your mouth and say, ah. That's when you're assessing 9 and 10, because you're making sure that the uvula is midline, that the palate is raised, and that it's symmetrical. All right, so 9 and 10, say ah. 11 is the sternocleidomastoid. And so that's when you're looking at assessing head, shoulder strength. And so you can have a person, shrug their shoulders, or give them resistance towards one side, because you're assessing this area here. And then last but not least is 12. And 12 is when you just ask a person to stick out their tongue. Okay. And so you're looking to make sure that the tongue is midline. Now, the most important of all of these nerves is cranial nerve 10, which is the vagus nerve. And it's most important because it actually innervates from the neck all the way down to the GI system. So it's involved in the autonomic nervous system as you're getting blood pressures, heart rates, any of the GI digestive tract can be involved with that. So it's more of the movements that are essential to life. However, we don't have control over them. Like we don't control how fast our heart beats or how our blood pressure is, not directly anyway. The body is going to do that in order to compensate for whatever is going on. So I hope that helps. Those are the 12 cranial nerves, and so we'll continue to go through the rest of the physical assessment. Bye for now.